Video 26, Introduction to Implementation Phases, Area 3, CHES Subcompetencies 3.3.1. Review the learning objectives for this video. Alright, let us talk about how health education programs actually get off the ground. Here is something really important to know. Implementation does not happen all at once. It follows a structured sequence of 3 phases, and understanding this sequence is going to serve you well on the Certified Health Education Specialist exam. The first phase is pilot testing, and this is essentially a small-scale trial run of your program. During pilot testing, you deliver the program to a limited group, often just one site or one cohort, to identify problems before they become widespread. Think of pilot testing as a dress rehearsal. You are checking whether your materials work, whether your timeline is realistic, and whether participants respond the way you expected. Here is a concrete example for you. If you are launching a nutrition education program across 10 schools, your pilot might take place at just one school with 2 classrooms. That small-scale test lets you catch issues like confusing worksheets or activities that take longer than planned. The second phase is phasing in, where you gradually expand the program to additional sites, populations, or locations. Continuing our example, after a successful pilot at one school, you might phase into 3 more schools while continuing to refine your approach. This allows you to make adjustments based on what you learned during the pilot, which is incredibly valuable. The third and final phase is full implementation, where the entire program is delivered to all intended participants across all planned settings. Now here's the key thing to remember. Each phase builds on the lessons learned from the one before it, creating a feedback loop that strengthens the overall program. For your exam preparation, keep in mind that skipping directly from pilot to full launch is considered poor practice in health education. You will definitely want to remember that. Now, before you move from pilot testing to phasing in, you need clear criteria for deciding whether the pilot was successful. This is a really practical skill, so let us walk through each of the 5 criteria together. The first criterion is participant feedback. Did participants find the program useful, engaging, and relevant? You can collect this through satisfaction surveys, exit interviews, or focus groups conducted shortly after the program ends. This kind of direct input from your audience is gold. The second criterion is fidelity. Fidelity asks whether the program was delivered as it was originally designed. If facilitators skipped sections or changed the order of activities, that affects your results and makes it harder to determine whether the program itself is effective. On the exam, you might see this presented as a question about why consistent delivery matters during a pilot, and now you will know the answer. The third criterion is feasibility. Were the timelines realistic? Did you have enough staff, materials, and budget to run the program smoothly? If your pilot required 2 facilitators but only 1 was available, that signals a feasibility issue that must be resolved before expanding. The fourth criterion is preliminary outcome data. Even though a pilot is small, you should look for trends in the right direction. Are knowledge scores improving? Are participants reporting behavior changes? These early signals help justify the decision to expand, and they are encouraging to see. The fifth criterion involves staff and facilitator observations. The people delivering the program often notice things that surveys miss, such as confusing instructions, activities that ran too long, or technology that did not work properly. All 5 criteria together help you make an informed decision about whether to expand. So to recap, you are evaluating feedback, fidelity, feasibility, outcomes, and staff observations before moving forward. Keep those 5 in your mind as a checklist. A common question you might be asking is, why do we not just launch the full program right away? That is a great question, and the answer comes down to risk management and quality assurance. Phasing in allows you to make incremental adjustments. If something does not work at the second site, you can fix it before reaching the third site. It also reduces the risk of large-scale failure. If you launch everywhere at once and discover a major flaw, every site is affected simultaneously. Let me give you a real-world example that really brings this home. If a health department launches a new screening program at all 20 clinics on the same day and discovers that the intake form confuses patients, all 20 sites must stop and retrain staff at once. Had they phased in with 3 clinics first, the fix would have been simple and localized. You can see how much smoother that would be. Phasing in also builds staff capacity gradually, giving new facilitators time to learn from experienced ones. It also generates evidence for stakeholders. Funders and administrators want to see that the program works before committing full resources, and you can provide that evidence through a phased approach. On the other hand, an immediate full launch offers no opportunity to correct errors in real time. It demands all resources at once, which can strain budgets and staffing. Staff may feel overwhelmed trying to implement something they have never done before at full scale. And if problems arise, it becomes much harder to identify what specifically went wrong when everything is happening simultaneously. For these reasons, best practice in health education strongly favors a phased approach to implementation. Here's a helpful exam tip for you. If a question presents a choice between launching immediately and phasing in is almost always the correct answer. You have got this. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is B. The pilot revealed specific fixable issues with session timing and handout clarity. The appropriate next step is to address these issues and then phase in gradually to a few more sites, not jump to full implementation or abandon the program. Adding more sessions changes the program design without addressing the root causes. Summarize the key takeaways